Yeah, maximum. For the patient, patient will suffer always. Patient suffer double two ways. One is money, monetarily it is disproportionately high money, where what they are paying is not, they are not getting what they should get. Isometric neck exercise, for example, you are working on a scalene muscles, you are working on a sternocleidomastoid, how to do, how much to do, all those. If you are doing, you are doing much better. If you, but you are not able to do any gimmick, you know. There's no regulatory body. Regulatory body, anybody comes. For example, I mentioned first time I mentioned Ayush doctors, 7.5 lakhs Ayush doctor practicing allopathy. Every health agency, every health officer knows 100% who is Ayurveda doctor, who is practicing. Ayurveda doctor should not hold injection. They are filled with injections. Next to here only, everybody knows. But the health officer is getting 1.2 lakhs salary. 6,000 rupees to 8,000 rupees per month based on the size of the hospital from all Ayush doctors should go every month. Not in a hand, but in a packet cover it should go, and then he'll be coming, officer will be coming to a certain area. He'll come, his vehicle will be standing in one corner. Either some nurse staff or some of them or some of their side, they'll come and collect the packet. Sir, cover kottidini sir. You have to say this. Cover kottidini sir. Cover kottidine sir means you have to understand that, sir, cover kottidine, this month's your hafta is taken, don't disturb me for next 1 month. So the patient, the doctor who is unethical already, who is practicing, and he has already hired those health officials who will, even if you give complaint, they will not take complaint. Even if they take complaint, much before the raid, they'll say, ಎಲ್ಲ ಇದು ರೆಡಿ ಮಾಡ್ಕೋ, ನಿಮ್ಮ ಅದು ಹಳೆ ಡಾಕ್ಟರ್ ಯಾರಿಗಾದ್ರೆ ಕರೆಸ್ಕೋ, keep all those people ready, and we are coming for the raid. Finished. So it's only amongst yourself you should create an awareness where you make a government. You are, for example, you are a 10 people team. I want to learn more. Maybe some contents we can create. So that's my interest is that where train people. I am not trained everything in everything. I might be knowing some 2-3 marmas to tell you maybe. Even though I studied for 14 years, I left my medical career because I'm in between. Neither totally into conventional medical science, not totally into Ayurveda. I'm not Ayurveda doctor, but I can speak Ayurveda much better. So Ayurveda concept is Vata, Pitta, Kapha. Vata is a kinetic energy, Pitta is a thermodynamic energy, Kapha is a potential energy. Grossly correlated to Vata to ectomorph, thin built personality, ectomorph, Vata. Medium built muscular body is Pitta, mesomorph. Morphology, no? Mesomorph personality. Chubby, thick person is more of a potential energy, is more of a what you call endomorph. So that's a very gross correlation. Like that, I know about other field of medicine. I can correlate with them. Okay, sir, meet Ayurveda doctor. Sir, you do, very interesting. You read about this. Last. Terpenes. So we can find out neuroactive terpenes. So Ayurvedic massage, when I do any massage therapy, neuroactive terpenes will get activated. For example, they'll use Nux vomica. What is that, Abel? We did something for the dad. What is that called as? Kanji Dara Kashaya Dara. What is that? Kanji Dara Kashaya Dara. What they use is Nux vomica. Nux vomica is a potent poison. Nux vomica, strychnine, Nux vomica, and burin. There are 2 contents in that. So they call it as a quack button. Quack button. Quack button means any pain, anywhere, any neuropathic pain, any joint pain, any muscular pain, any fracture pain, any migraine pain, we'll use this. So it contains strychnine. Can you double check and confirm? Terpenes and strychnine, burin. Strychnine is a nerve stimulating agent. Burin is analgesic. So in Ayurveda they prepare, Naksomika they prepare, freshly prepared, they boil this with milk, 10 liters of milk. The potent poisoning content of the Naksomika reduces, it will become more of strychnine and burin. Strychnine and burin you are not taking internally, you are pouring on the body, simply pouring on the body for maybe 10 sessions, 15 sessions. Severe cervical spondylosis, severe radiculopathy will reduce instantaneously. Why can't we adopt, for example, why can't we adopt Nexomica? I want somebody to double confirm. Quack button, quack button. This is purely used in Ayurveda. Ayurveda doctor knows how to detoxify, desensitize. They'll use a pure form of ghee to reduce the potency of the toxin and make it less potent. Ghee and milk is used. So they'll pour it on the body. We'll show you. I'll share some. So strychnine and burin. Burin is analgesic agent. Strychnine is nerve stimulant. So for example, you are having a severe sciatica patient. You do whatever you are doing. You send your patient to the Kanji Dara, the Naksomika Kashaya Dhara. So Naksomika boiled with a milk, and 10 liters of milk boiled. Patient is lying down, it is poured on the body. We'll do the treatment. See the magical improvement. That is a single case study. Patient symptoms are recovering, you are fine. We are not able to treat in spite of a neurologist recommendation, neurosurgeon's recommendation. Neurosurgeon says, okay, let us operate laminectomy, discectomy, because 44% they have a pressure on the head to operate, increase the revenue for the hospital, because the hospital owners are not doctors. They are somewhere sitting in America. Blackstone is one more. Hong Kong based company has adopted one of the some gynec company. Manipal has been adopted by Singapore. Blackstone owns majority of the stakes in some major companies. So this is just to give you a small hint that healthcare scenario is changing very drastically, very significantly. If you do not create your own individual edge or identity or elite or premium content in yourself, you will be left behind. That's the only message. So for that, integrative physiotherapy or integration of other teams with your work can make you stand apart from the crowd, because there is a competition everywhere. I hope this gives a small glimpse of introduction to what is happening around.
Here, any patient who comes, for example, like an outpatient with arthritis or someone has come, how do you go? Like they first come and consult.
Yeah.
And whether you for every patient you do as a holistic method, like both allopathy, ayurvedic,
Usually,
physiotherapy all together, or how is it?
usually our concept method is the holistic one only. First, when patient comes, if it is a quick one, fever is there, I'll not do much holistic. Okay, take this 3 days medicine. Say okay, all on and off, it's gone. If somebody is coming with migraine, we'll offer maybe at around 350 rupees or 500 rupees. We offer a holistic consultation, 60 minutes. So first I'll see the patient, BP, UP checked, all vitals are measured, your BMI, BMR, daily calorie requirement, everything is counted. There is some machine which will come, it will do the count, and I'll evaluate and I'll do some, if there is a pain, elderly patient pain, machines also you should use more machines. There is a vibratio sense machine which will sense the vibration sense. In diabetic patients, vibration sense is reduced. So check the vibration sense. If vibration sense is reduced, you are more prone for diabetic neuropathy or early neuropathy started already. So pre-GABA is a choice of medicine I'll give. I give pre-GABA medicine. I'll say, okay, go to the physiotherapy doctor. He will evaluate. So they'll evaluate details things. Okay, range of motion are fine. Proximal muscles weakness is there, or their cores are weak or whatever. All the assessment is done. Then they'll go to the Ayurveda doctor. All at the cost of 350 rupees. And then in this we do not want to add corporate commercial part. We don't suggest anything unless patient wants. Then these three doctors will discuss. Physiotherapy, Ayurveda doctor and allopathy doctors will discuss what can be done. Okay, JPMR relaxation technique. Teaching. I'll teach it once. I have it on YouTube. I'll say 40 days every day you do. So I've given it away totally so that majority of the people don't do when you're getting everything for free. But even if it is there, it is content is there. So I'll give it. So JPMR practice, biorhythm of the body changes. Indirectly, JPMR helps for neck pain, back pain, knee pain, sleep issues, BP. 3,960 plus research on the JPMR itself. JPMR is a Jacobson's progressive muscular relaxation technique, where Jacobson was a Canadian physician very much interested in yoga. So he taken out all the religious component and only taken the essential component, biorhythm, contraction of the muscles and relaxation of the muscles, and being aware of that will change the biorhythm of the body and brain, and it will also change the sympathetic pathway, or it will also change the vagal tone and relieve the things. Last to end is majority of our people, if raise your hand, move the index finger only, look at it, you're able to do. Now drop your hand down, move the second toe without moving the other toes. Move the second toe without moving other toes. Possible? Why? Why? In our own body there are differences where fine motor skills are maximum here, fine motor skills are less here. But if it is being trained, you have seen somebody who is writing with a, don't have hands and writing with the leg, because it is a training, it's your work. What I mean to say is, if you train it nicely, if you train it effectively, if you make yourself elite edge, premium edge, we should project it, and we should have that content comparing to any of our own people, our own professional competitors and others. For that we should have a competitive edge. For that we usually add this kind of concept. This concept is new, and we find very difficult. I am struggling since 10-14 years traveling around. So recently got searching for another place. So Divine Grace Hospital is what I got accidentally while searching for a place, because I have a team of physiotherapy, Ayurveda doctors, naturopathy doctors, homeopathy doctors, and interdisciplinary talks are very less. How many of physiotherapy doctors will sit and talk to a neurologist? Neurologist will never allow you to talk. Smart smart quadricep strengthening maad hogaste. They disrespect what I have seen. Disrespect is very subtle. They no need to scold you directly. Disrespect is very subtle. Very subtle means, okay, patient is complaining a lot. Okay, do aggressive physiotherapy, quadricep strengthening, hamstring training. What else? To what level it is stiff? Let the doctor analyze. You should pay consultation with the physiotherapy doctor. Let the doctor evaluate. The evaluation page itself will be around 12 pages. Evaluation is there. What is strength? What is the level of rigidity? Range of motions, patient outlook. If you create that structure amongst your own circle, if it is a bigger hospital, they won't listen. They have a protocol we must follow. Work, see how it is, and also by side create your own stuffs is a better idea. Okay, I'll stop here, and it's open for any small questions. And if it has unlocked 1% of our mind for one-to-many concept wellness activities, I want you to get involved with us. Wherever, if I get any chance anywhere, like Volvo, there is some postural training program. Maybe one day before, somebody you want to go, I'll do the personal training, 2 hours training. You go and do it. You'll be well known. That way you can explore. Okay. Thank you. Thank you, Ananda. Have any questions you can ask, otherwise you can.
You were telling about motor competitors.
Sudra.
Does acupuncture really induce cortical activation?
Yeah.
I mean, there are researchers.
100%. I can show you. I can give you. Acupuncture. So there is one research. They have done a research on a cadaver, dead body. So normal cadaver skin. This is very eye opener for me. Sorry, Abel. This is a permanent marker. Cadaver skin. So they have done acupuncture for the cadaver skin. So they found that the skin structural change was present even in the dead tissue of the cadaver. 19 57 to 59. I'll show the research to you. Share the research. So even dead cadaver skin changes with acupuncture. Normal skin there will be, first there will be shock, prick, will infuses more of endorphins immediately. It will activate cutaneous C fibers. There are nerve sensing fibers, superficial and deep. You use counter irritant mechanism. Apply Amrutanjan to the knee. Superficial nerves are stimulated, irritated. Deeper pains are forgotten. Counter irritation mechanism. Counter irritation mechanism. Like Amrutanjan, pain balm, whatever you give. See another point. Normal physiotherapist uses a diclofenac gel. Example. You use a gel which is having a pre-GABA in it. Example. Effectiveness will be more. Simple addition. This costs you more. Pre-GABA gel, application of the pre-GABAline gel plus diclofenac. Then do the physiotherapy. Effectiveness of physiotherapy will increase.
It's a combination of both.
Combination of both, local application. So yeah, there are changes. I will share maybe some of the. I have more interest for acupuncture how it works, and it works till the level of ATP and ADP. Adenosine triphosphate, adenosine diphosphate, mitochondrial level it will change. So there is one research conducted shows that when acupuncture is pricked, it will increase vasodilatation. What is the shock wave treatment? Similar to shock wave treatment, there will be vasodilatation. When it is seen with infrared camera shows there is an increased vasodilatation of that area. Blood circulation increases because brain confuses. Okay, why there is only one localized area is having some change. Brain focuses on that area more. Infrared camera shows there will be vasodilatation. Vasodilatation causes muscle relaxation. Muscle relaxation relieves the pain.
So it is not a mere correlation.
It actually induces
cortical
activation because you are having reticular pathway, pain pathway. A gentle lady with pin prick will feel more pain with a trained army man with a gunshot wound. You see the difference? A gentle lady with a pin prick can feel more pain compared to the warrior army person who has been trained thoroughly for all these years and still having gunshot wound. Till he wins the war, he will not feel the pain. Once it happens, because there is a profuse release of dopamine based on the training of the mind. Training of the mind, pain pathway, there is a reticular system. Reticular pathway. The reticular system is involved with emotions. So when physiotherapy you are doing, you are saying, oh, it is going to reduce. Do not worry. Emotions are changed. Reticular system changes. Your amygdala changes. Amygdala is full of fear. Female amygdala and hippocampal areas are larger. Female emotions are complex, compartmentalized. So I'll give an example of how a physiotherapist can be a family counselor. Female mind will be more of compartments. Amygdala is bigger, hippocampal area is big. So when there is a fight between husband and wife, male mind is more of a hunter and gatherer. So hunting and gathering needs focus. Focus only frontal lobe activity. Frontal lobe, plan, give solution, plan, give solution, plan, give solution. So they can remember more map. Understand? Because their mind is trained in this way. Primarily it is trained in the focus and frontal lobe activities. So when wife is telling something about her emotions, solution is to listen and keep quiet. Don't offer solution. You should listen. Absolutely, you should listen. Okay, yes. with all empathy. You should bend down, look into the eyes, have empathic emotions. Okay, just amygdala hippocampal area is large. She has to speak it out. Only when she verbalizes, then only she feel comfortable. Compartmentalized brain, amygdala hippocampal areas are more. She must verbalize. When man is having this, he'll focus, he'll become quiet. Men with depression will lose weight. Women with depression will gain weight because kitchen is near. Kitchen induces dopamine release. Dopamine release, brain reward system. Brain reward system, I feel happy. It will cushion. Male will starve. You become counselor now. Correct? Correct, no? It's a science, purely science. Amygdala hippocampal area. There are some epilepsy patients where uh, as a part of operations amygdala is removed because epilepsy foci was there, so their emotions become very vulnerable, very difficult to manage. So for them repetitive cognitive behavioral therapy, physiotherapist can add daily activities. CBT, cognitive behavioral therapy, can be daily physical activities, daily task based activities, daily fine motor skill activities with mind body activities. If it becomes everyday activity for 40 days, 50 days, 60 days, it is nothing but a cognitive behavioral therapy, is it not? So open, let us have the open mind of having authority as a physiotherapist, but also add up other things and then give the best. Hmm? I'm available for a phone or reach out anytime. Either you can call Abel and other team members. And I wish you to visit our place little frequently because it is a small unit with a little idea to bring an integrative concept in an affordable way. As I mentioned, the private sector investment and all those. So I feel this there is a space for affordability and individual growth. So we focus both on not just the institution. If I am part of Manipal, if I am kicked out, if anything happens to me, next day another person will replace me. So individual identity and the individual institution identity both should be enhanced. So for that, you should have a typical edge over other professionals. Okay, thank you.
Thanks for each of you.